If you've attended the last webinars, you know that my name's Katie. I am part of the Canadian Veterinary Medical Association National Issues Committee and Environmental Working Group. And I'm pleased to announce this final sustainability webinar in our webinar series, which has been co-sponsored by the Canadian Veterinary Medical Association and the Canadian Animal Health Surveillance System, and delivered through a collaboration with Veterinary Sustainability Alliance, which is a nonprofit group operating in Canada and the United States. And so I'm also a director for Veterinary Sustainability Alliance and will be presenting this final presentation. My co-pilot, Dr. Will Sander, unfortunately can't be here today for the rescheduled version, but he has contributed extensively to this presentation, and so I extend my thanks to him today. So today we are on the part 3 of Pathways to a Sustainable Clinic, and we're really talking about community and building sustainability within the community. And so if you recall from webinars 1 through 3, the first webinar talked about what's happening to animal health in regards to the climate crisis and the potential impacts we can see, and also why it's relevant to veterinary medicine, not only from the standpoint that animal health is being threatened, but we also contribute to the climate crisis because our activities have carbon emissions, just like every other activity that many of us engage in. And then we started off with the core of our Pathways to a Sustainable Clinic framework, which really looked at building a team of individuals that were really excited about sustainability, seeing what your baseline ecological footprint was of your clinic, establishing goals, and setting yourself on a path to success. The third webinar was the clinic aspect, which really looked at behavioral and physical changes across many areas of your clinic where you could start to implement changes to reduce the environmental impact from your clinical activities. And today we get to community. And so today is about championing what you're doing in sustainability, messaging it to the world, and also thinking about how we as veterinarians can really play a role in building a healthy community, which we do in many regards, by looking at things from an environmental lens. And so just like our other pathway components, we've divided this up into 5 key sections of focus. And so health really talks about expanding access to care and preventative medicine for animals in need, and we'll address how that relates to sustainability and why it's relevant. Stories, speaking openly about your sustainability journey and why you care. And there's many benefits to sharing stories. Connections, so engaging with professionals, networks, and allied health sectors and beyond to really build your network, communicate with others, and learn from others. Policies, so your role in advocating for animal health, welfare, and sustainability to decision makers. And then nature, so looking at how we can, within our own clinical environment and with our own areas, really support the ecosystem services that exist that come around to support the animal populations that we care about. So why do we talk about community at all in our pathways? And this really goes to this diagram, which Vet Sustain, which is another organization that operates in the UK, sort of a similar mission as Veterinary Sustainability Alliance, and where we can make impacts and how we can sort of have ripple effects outwards. So it's important that we make personal changes, household changes, in clinic changes to support a reduced carbon emissions and ecological footprint. And the more we kind of expand this spheres of influence, the more impact we can have. So if we think about different things that we can do on the community level, it brings in additional people, it starts to have ripple effects, so other individuals change, you can become a leader and lead by example, and then we can go into wider societies. And this can also help with bigger sort of systemic changes, which many of us know, you know, we can toil away personally making a lot of personal changes. But if the system doesn't change, it can be very hard to make really impactful, have a big impact on our carbon emissions. And so we include this community aspect to think about where we can start sort of shaking things up and leading to system level change as well. So the first thing we're going to talk about is something that you likely already do, and we're really just going to celebrate the co-benefits of this and give you another rationale for why access to care and preventative care is so important from a sustainability lens. So treating animals, keeping animals healthy supports a healthy environment. And I had once heard a physician who is very active in the sustainability space, say to me, every test, every medication, everything you do has an associated carbon footprint. It doesn't mean that that's not important, what you're doing, but the more we can prevent in an evidence-based way, the healthier our animals will be, great benefit. And we're also using less resources, which can have an environmental impact. And so key components that you are likely already doing, but really have that co-benefit for environment, sterilization practices, so preventing overpopulation. Again, we love the companion animals that we have, but if we have many companion animals that don't have homes and require resources to keep, sterilization is a really great way to keep a healthy number in our animal population and minimize that impact. Appropriate vaccination and deworming to make sure that if something exists in our area, again, in an evidence-based way, that we're keeping our animals healthy. Nutritional consults is a really big one. And so a significant amount of carbon emissions come to feed the planet. We all need to eat. We all have energy requirements. And so obviously there's no way around eating. I'm sure we wouldn't want there to be either. But overeating can lead to increased food production and increased emissions. And so there are research articles out there that sort of gauge the carbon emissions associated with overfeeding, and it's quite significant. We also know that we have an obesity problem within our pet population, which can cause numerous other health impacts. And so this is just another positive impact about doing nutritional consults and making sure that animals are getting the appropriate nutrition that they need. And then going on to the same idea, prevention and management of chronic diseases and education. There are studies to show that this may or may not be the strongest motivator for pet caregivers. Again, probably improving their pet's health is likely the strongest, but we can celebrate the co-benefits, and it's another rationale for continuing to prioritize prevention and make sure that clients know why prevention is so important. And again, we're not a preventative care organization. There are lots of great guidelines that exist, and so we just share those, and we're not going to go into those today. The other component about this preventative care is recognizing the importance of access to care. And again, we're not an access to care organization, but I think many of us know within the veterinary profession that we do have an access to care crisis. There are many populations that just can't access veterinary care for a multitude of reasons. The reason why this ties in to environmental health and our discussions about the climate crisis, yes, relate to prevention and the importance of preventative care like I just talked about. But there is very clear evidence that many of these underserved and vulnerable populations are also more likely to live in or near less healthy environments. So the concept of environmental justice or environmental racism might ring a bell with you, where individuals, typically individuals in communities of color, may live in areas that are more polluted. And this can challenge and cause many different health effects. And that relates to the companion animals that they also have. We know that many of these populations also bear the burden of the negative health impacts of the climate crisis more so than anyone else. And so We know that carbon emissions are vastly created by the global north, yet the global south and parts of the Canadian north are warming at a faster rate and experiencing more impacts of the climate crisis. And all that combined, they have the least ability to cope because they have the fewer accesses to resource. And so that's why we really advocate about supporting access to care, because it's a messy interconnection with the environment as well, and an important concept for us to talk about when we talk about the climate crisis and about building healthy communities as a veterinarian. And as you see, we know that even within many populated areas of Canada, we have issues with access to care. This is a recent publication that looked at mapping access to care. This is a very difficult metric to measure because, you know, it's not strictly the number of veterinarians per the population or anything like that, because access to care is a very complex issue. But as you can see here, this paper helps highlight some of the potential areas where there is less accessible veterinary care. And you can think about how you might connect with other organizations to support access to care within your area.
Katie, I just wanted to let you know we're not seeing your screen.
Oh,
Sorry about that.
how long has that been going on for?
Since the beginning, sorry.
Oh, okay. Let's see. That's kind of comical. So I will go over each slide. Do we see it now?
Yes, thank
Okay.
you, Katie.
Okay. I will go backwards just to see. So this was this interesting spheres of influence diagram that I was talking about, where we see personal, household, community, and society, where I was really just talking about the ripple effects as we continue to expand our efforts within the climate change mitigation space. A lot of these are just words. And then this is the map of accessible care. And the article is Neal et al. 2024. And I know that there's also other ongoing research trying to provide metrics for access to care as well. And certainly there are organizations within Canada that really focus within this space, including Community Veterinary Outreach and Veterinarians Without Borders, if you're really interested in learning more. Okay. Now we move on to stories, and this is about speaking openly of your sustainability journey within your community and beyond, and why you care. So why do we tell stories? And many of you probably resonate with this already. So stories are great for bringing light to issues. They can give real world examples to something that might be quite abstract or quite overwhelming, which is very true about the climate crisis. They can provide guidance to others so people can learn things from the stories that you share. They can help generate momentum. I know when I read a really exciting story that somebody has shared about what they've done, it can really help me think about, is this something that I can do within my own life or within my own workplace? And then it also helps illustrate wins to your team. So if you're sharing stories to the wider public, it's also giving your team sort of that boost and momentum they need. And we talked about that in our core presentation about, you know, some of these changes that support reduced carbon emissions can be challenging and require a lot of work, and being able to celebrate the wins that your team have can be really important to continuing to generate that momentum. So what are stories and how do we structure them? Well, many of you may be like me. You're scientists, you know about evidence, you probably go to journal articles or at least summaries of journal articles to find out what sort of the scientific evidence is telling you, which is not really how the public consumes knowledge, or at least the vast majority of the public. And stories have really been shown to be effective at telling the public what they need to hear. So the bottom line, the so what, and then some supporting details if necessary. And so if we're looking for buy-in and we're also looking to generate momentum at that community level, sharing our stories can be the most effective way to to build public buy-in and public engagement. And further, stories are compelling. And we know we consistently see likely more and more of these articles that shed light on what the climate crisis is doing to our companion animal populations or wider animal populations. I've shared two here, catastrophic floods in Brazil, and talking about huge populations of animal homelessness. We know recently in the Northwest Territories, there was massive evacuations in 2023 from extensive forest fires, and a lot of companion animals and wildlife were affected by those fires. And so these shed light on the issue and sometimes are that push and motivation for individuals to make changes and start thinking more broadly about this. And finally, stories illustrate demand. And so in some of these cases, this can be helpful for us to make internal changes and also show other individuals why a change is needed. And so we've included a few examples here of stories that we've previously shared in other webinars about research that has shown that pet owners actually are willing to pay more for ethical and sustainable products, that they want their veterinarians to be knowledgeable in the climate crisis, and they want to know what's going on in their clinic about climate and climate change mitigation. So how do you share these stories? And, you know, in a busy clinic environment where you're already trying to make these changes and that's already a big task, now we're asking you to do another thing. Well, stories can be really simple. Stories can be shared through signage. So if you've made a change in your clinic, showcase it with a sign. So maybe you've planted a pollinator-friendly garden outside of your clinic if you have, you know, access to green space, depending on where your setup is. Then put a sign with it. If you've installed water-saving devices that are publicly facing, so maybe in your public washroom, put a sign with it. It serves an educational purpose too. So it shows that you care. It gets people interested in promoting, and then maybe they walk away and think about, maybe I can plant a pollinator-friendly garden in my neighborhood as well. Social media can also be a really great tool. Social media can sometimes not be a great tool, which I'm sure we've all experienced, but there are many ways it can be used to the advantage to share stories about sustainability and what you're doing. So it can invite others to the conversation, especially if you allow comments and people can discuss what you're doing within your clinic. You can reach a wide audience, especially if you have multiple platforms. And you might get interest from other businesses within your community, and it can facilitate community challenges with other businesses. So maybe there's several local veterinary clinics, and you're all going to partner up for a certain type of eco challenge in Earth Month. I mean, you can share that on social media and promote some friendly competition that allows others to engage in why you're doing this and what the benefits are. For best results, you can consider posting regularly, for example, with themed posts, so Eco Tuesdays or monthly sustainability snapshots. And of course, like any best practices for social media, using images and creativity is more likely to attract viewers. You can also hold clinic events if that's something you're doing. We pulled this picture from social media. It's from a clinic actually in Ontario where they were having a composting event around Earth Day. And it's a great way to invite clients into the conversation, to showcase what you're doing, to have fun with staff and build excitement around sustainability initiatives. One thing if you are doing things within your clinic, big or small, we have an opportunity for you to share your stories at the National Issues Forum. So I'm going to talk about the National Issues Forum at the end of this discussion. The contact information seemed to disappear from my slide, but you can send your a slide, just a PowerPoint slide of what you might be doing in your clinic with some photos to Dr. Ian Alexander Maybe we can put his email in the chat if Dima is available. And then these are going to be cycled through at the National Issues Forum to showcase to other veterinarians what you're doing and really generate that momentum and facilitate story sharing. Another opportunity is community speaking, and maybe some of you already do this. And so this might be by hosting events, within the community, talking to local newspapers about what you're doing, which is pictured here on the left-hand side, where a veterinary clinic went full solar powered, and they talked about what they did and why they did it, and this was broadcast in the wider media, and had a dual purpose. It's promotion for the veterinary clinic, and it also really started promoting ways in which changes could be made and showed how they were tangible. Maybe you do educational events with kids. We have our own BSA's own Colleen Duncan here doing a necropsy with a loon and kids. And she does a lot of in-class engagement with youth who are particularly concerned about the climate crisis and really want to know how they can help. And you can be both an educator on how this is affecting our animal populations and also show them how you are changing within your own practice, as sort of continuing that story and that knowledge sharing. So really, it's all about engaging with your community and really creating, oh, I went too far, those ripple effects. So the more we talk about what we're doing and why we're doing it, the more people will hear about that. You know, not everybody is going to think about it. Not everybody is going to jump on board. But the more we talk about it, the more momentum we will create. Okay. So now we're moving on to our third pillar of community, which is thinking about building connections. And this talks about engaging with professional networks, allied health sectors, and beyond to continue those conversations and knowledge sharing. And so connections facilitate sharing of resources. No need to recreate the wheel. And I think that this is really important in the sustainability space. And I've said it time and time and again. There are so many different lessons learned that we can pull from other professions, from what other individuals are doing. We don't have a ton of resources in the sustainability space, especially within veterinary medicine. And so the more that we can facilitate resource sharing, one, there's environmental benefits because we're sharing resources, and two, we're making sure that we're using our energy and effort in the best and most effective way possible. By building connections, it also builds a community for support. And so you're all here, whether because you've tried to do sustainability stuff in your clinic or you're thinking about it. Hands down, the climate crisis and changing our practices to support more sustainable practice is hard and overwhelming. And I don't think anybody that has worked in this space will tell you any different, other than there are also benefits and we know how important it is. And by having those connections, you're going to build a community for support. And that's really necessary, especially if you come up to barriers. It'll help you figure out how to overcome those barriers or just give you a sounding board if there's frustration or disappointment. And finally, it also contributes to a collective voice to facilitate larger changes. And if you recall, I talked at the beginning when I was talking about those spheres of influence and about the need for we need to shake up the system, and some things we need larger system level changes to happen. And the more collective voice and connections we build, the stronger that collective voice will get. And so we just have some examples here about what these connections or who these connections might be, and how that can be valuable. And so the first types of connections we have up here are environmental organizations within the veterinary space. And so if you're in, I'm sure you're all in Canada, but Canada and the United States, we have Veterinary Sustainability Alliance, but we're not the only ones. And so Vet Sustain has been in operation for quite a while, and they're based out of the UK. They have a ton of fabulous educational resources for veterinarians, which Vet Sustainability Alliance is not seeking to replace. and we can all build upon our efforts. Veterinarians for Climate Action is based out of Australia, and again, they have some really great resources. Some of these may be specific to the geographic area that you're in, which is why we have geographic specific organizations, because as you know, the climate space is different in Canada versus the United States versus Australia, and many of our systems are different. And so having those nuances is important, but we can all share and learn from each other. The other organization that we put a logo up here for is Not One More Vet, which you may be very familiar with. It supports mental health and well-being within the veterinary profession and is an incredible organization. We put this up here again. I mentioned that working within the sustainability space and climate change and mitigation can be very challenging. Many of you, myself included, may have experienced or continue to experience ecological grief and sadness associated with what's happening to our ecosystems. And so making sure that you also take care of yourself and reach out to colleagues for support when working within this very difficult space is really important. Now we can think about connections outside of veterinary medicine as well. And the CVMA has actually been working really hard to build some of these connections, including with the Canadian Coalition for Green Healthcare, for which they sit on as an allied health profession. And these organizations can really promote efficient and effective sharing of resources. There are many things, yes, veterinary medicine is different than human medicine, but there are a lot of things that are very similar. Anesthetic machines, the anesthesias, some of the anesthetics that we use, different healthcare products, personal protective equipment, all of those sort of things. And there's been a lot of advances within the human healthcare space to improve their practices to be more sustainable. There's, you know, the human healthcare space is a lot larger. Their carbon footprint is a lot larger. And so they've put together a lot of important resources. And so maybe if you can't find something specific to the veterinary space that you're looking for, going to an organization like Healthcare Without Harm might be a really great place to look for more information. It also, by collaborating and connecting with professions outside of veterinary medicine, it can generate a larger collective voice. And so improved health for all, recognizing the importance of the environment, is a goal across different health professions. By making connections outside of veterinary medicine, this might also provide you with an opportunity to contribute locally, provincially, or nationally based on other areas of interest as well. And so maybe you're particularly interested in nature preservation with a local environmental group, and it provides you a different way to also contribute to climate change mitigation. Okay, so one example we have is where we think that connections is going to be really important. Somewhere where VSA is very interested in working and building a collective voice. And the example is in procurement. We, as veterinarians, buy a lot to practice veterinary medicine, which makes complete sense. There's lots of different resources that we need. And procurement can be very overwhelming. It falls into, if you remember, we talked about scopes 1, scope 2, and scope 3. Scope 3 is sort of all that other stuff that we have a lot less control over because there's many integrated supply chains. So there was an effort by colleagues at Colorado State University to look at what of veterinary procurement companies, what existed in the sustainability space. And so they contacted 380 companies. They only received 54 responses asking, and the survey was pretty simple. It was, do you have any kind of sustainability plan? And is it public facing? And so only 13 had any kind of sustainability policy. And this was done a little while ago, and so hopefully there's been some advancement in this. But for us to actually be able to have access to additional things and change that supply chain, we really need a collective voice. And so for you as an individual practicing veterinarian, this can be continually asking company representatives for life cycle assessments of their products. So, sometimes companies like to slap a little green symbol on it and say that it's green, but there's no evidence to support that. And so life cycle assessments of products help us look at the whole chain of the product and not fall into greenwashing. You can request sustainability policies and updates on their actions. So both are kind of key. So some companies will have a policy, but they haven't really done anything about it. And so the policy is a good step in the right direction, but there needs to be some action behind it. You can start telling vendors and people that come into your clinic that you evaluate sustainability practices when you're making a product decision. And when you do buy products, if third-party certification exists for those, and that was covered in some previous webinars, make your choice based on those environmental and social third-party certifications, and tell people that you're doing that. So more and more people understand how important it is so that we can sort of start to tip the scale in the product chain development. So the next thing we're going to talk about is policies. And this is really talking about how you as a veterinarian can make your voice heard to advocate for animal welfare, health, and sustainability to decision makers. So climate change is a multifaceted issue, and it's highly complex. And we know that. We've talked about it. And giving this complexity, it requires interdisciplinary collaboration and bringing many different individuals on board if we want to establish effective solutions and have impactful policies. So veterinarians, we have our primary role as animal health, but we also make a commitment to promoting animal health, promoting public health and environmental health when we take our oath. And so this very much makes climate change within the scope of veterinary practice and combating climate change within the scope of veterinary practice. So veterinarians have a really critical role to engage with decision makers to talk about that animal health is being impacted by climate change and why that's important, and also to advocate for additional supports to help veterinarians improve their ability to mitigate climate change impacts and adapt to them as well. Some countries have different types of supports available for businesses, whether that's, if you install a heat pump, you get huge amounts of subsidies or things like that. And so many of those changes, we have to advocate to policymakers for those to be available to us, especially if there are big limitations in us being able to make certain changes within our practice. So for you as a veterinarian, and on the right-hand side, we have an image that was taken off of, I think, X, that shows members from CVMA at Parliament Hill talking about different issues within the veterinary profession with members of Parliament, including workplace shortages and access to veterinary medications. And again, the climate crisis, animal health, access to supports for veterinarians can all be important things that are on those discussions. So for you as a veterinarian, whether you're engaging with local representatives or national representatives, all of which are accessible to you, you can make crucial information accessible to them. And it's important to remember, I know a lot of people don't like to engage or don't necessarily engage with local or provincial members of parliament because they don't think their voice is going to be heard. But sometimes it's just a matter of being persistent, and you are a trusted health professional. And it can actually be quite reassuring when they answer your emails and bring forward things that you have indicated are a priority. And really, they'll never know that those aren't a priority until we have a collective voice that's continually advocating for that. So different places where you can connect depending on sort of what your focuses are municipal representatives, members of provincial parliament, or members of parliament. And engaging local could be a great first step. It can help you shape community action plans. And you can really be a leader within your own community, or a leader that much more because you already are a leader within your own community. We can also think about policies that exist from veterinary associations. And so there are several of these, which is really exciting and provides impetus for us to act and continue to work and engage within the climate change mitigation space. And so on the screen here, we have an excerpt from the World Veterinary Association position statement on the global climate change emergency. So this received support from 22 national veterinary organizations, including the CVMA. And it really emphasizes that veterinarians have roles as advocates for animal health and well-being and public health. And we also have the responsibility to protect ecosystems and to demand action to minimize climate change. And so we can not only lead by example, but also really be a strong voice to make sure that those systemic changes occur. So with veterinary organizations, the policies that they have could shape the policies that veterinarians practice within, and they can also influence provincial and national legislation. So national associations address broad issues, and the CVMA has taken a leadership role within the climate change space. They have a position statement, which I have on the next slide, on a veterinarian's role in climate change mitigation. And they've also started a veterinary sustainable practice initiative that really seeks to support veterinarians to improve sustainability within their practice. And so all of these things are starting to tip the scales towards addressing these broad issues. You might also have an opportunity to engage with regional or provincial veterinary associations that might address locally relevant issues, and you can advocate for different speakers or CE that might exist, or CE opportunities to think about sustainable practice initiatives within your own community. Or maybe you have an evening that's organized through some of these local associations where everybody is invited to come and share their stories about what they're doing and the challenges they're experiencing. And then you can problem solve on a local level about how to overcome some of these challenges to improve your sustainability initiatives. And of course, if you have time, you could consider speaking with board members on any of these organizations or volunteering with different committees. For example, the CVMA does have an environmental advisory group, and provincial organizations and local organizations might have a green group as well. Or maybe if it's really, if you're really excited about it, you could start a committee to help with on the provincial or local level. And here I've just included the policies that exist from the CVMA. The AVMA has recently published a policy as well. And finally, just to wrap up this conversation about policies, there are many pathways that exist for changing policies. And policies is sort of this catch-all term, which is essentially saying how an organization might want to do things. And so we have policies ranging all the way up to the national level, which might be law, all the way down to policies that you have in your clinic. And so there are lots of different types of policies, but they help ensure a consistent way of doing things. And so some of you may be part of corporate practices. Some corporate practices are starting to think a lot more about sustainability. But maybe as a practicing veterinarian within a group of a corporate practice, you can start having some of those conversations to think about where sustainable practices can be integrated and what changes could happen potentially across the board to, again, have those ripple effects. Professional organizations are another opportunity to engage. So we have CVMA and AVMA up there, but maybe you're part of a specialty organization like the American College of Veterinary Surgeons or ACVIM. Some of these organizations have started hosting sustainability talks and webinars and networking events to share relevant practices within their specialty area that support sustainability. And the more you ask for these and sort of advocate for those, the more it will become part of these professional organizations. And then finally, licensing bodies may have a role to play. I've put a couple of them up there, but maybe if you're part of a licensing body or are very active within a licensing body, thinking about how sustainability education could be part of required CE, or if certain things could be part of codes of practice. So there's lots of opportunities within the veterinary space to continue these ripple effects. And depending on where you contribute, you might see a unique opportunity for you to have that wider ripple effect. And finally, I get to our last section, which is on nature. And it's really about thinking we're embedded within natural ecosystems and how we as veterinarians and veterinary clinics can really support those natural ecosystems within the work that we do for our collective well-being. So I'm not going to go in depth into this slide as Dr. Duncan introduced a lot of these concepts in our first webinar, but we know that we are in a biodiversity crisis, which is why thinking about nature and biodiversity is so important. There are many things that are contributing to massive declines in biodiversity and disappearance of wildlife populations, including the climate crisis, which is intertwined with habitat destruction, trade, urbanization, all sorts of things that have made certain populations, that have very much challenged certain populations. So, and we're all embedded in these systems. Probably the system that has a little less nature, like on the left-hand side, is probably where most of us work, just because more people live in urban centers, but we might also work in more naturalized areas. And we can think about whichever system we work in, how can we foster nature and a strong ecosystem within those areas? So thinking about your local ecosystem, and some of these ideas may or may not be relevant depending on, you know, if your veterinary clinic is in a mall with no outdoor space, then maybe some of these things might be harder to convey and you might have to think of other ways that you can do it. But if you do have some natural space in your clinic, you could consider clinic landscaping, which has many co-benefits. So you could think about planting some pollinator-friendly and native plants, which can add beauty and make clients happy. They are pollinator-friendly, so they support pollinator populations. And many of these require less maintenance and less water because they're naturally adapted to the local conditions. You can think about planting shade trees. It can help with temperature control for your clinic, which reduces energy consumption. It also provides people, pets, clients with a place to sit outside. If you have the opportunity to install bird or bug or bat houses, some local conservation groups often provide these, and you can put a sign beside it to showcase what you're doing. And if you're really lucky and have some outdoor space, you could think about a small food garden. Some people have a green thumb. I personally love gardening. Some people want nothing to do with it, but it can be a place for the compost that you've started doing within your veterinary clinic. It can provide a mental break or reprieve for staff. Nature has incredible healing benefits that are well documented in the literature. And it could give access to fresh, healthy food. Obviously, in Canada, we can't do this year round, but it might be a nice thing to look forward to in the summer with many co-benefits. And so this slide just further looks at how we might support nature within our local ecosystem, about supporting a diversity of different plants and spaces for bugs and other critters as they're really important parts of biodiversity as well. And this slide is quite busy. This is a diagram that Dr. Sander had found that was specific to the human healthcare space that sort of showed within surrounding a hospital environment the different types of things that could be done within this area to support local biodiversity and the ecosystem. And now many of these ideas may not be accessible to you, but some of them might, or you might be able to contribute to them within your local community, such as your veterinary clinic sponsoring a community garden or sponsoring a pollinator garden or doing some tree planting or something like that to further your efforts and show your interest in supporting the local ecosystem. And so this diagram just zooms in to think about some of these different aspects, which might, include having some outdoor space at your clinic, which provides a nice outdoor space and can also have mental health benefits. Thinking about potentially contributing to a community garden, which could have many co-benefits, especially if you live in an area where maybe there's challenges with food security, and you can help contribute to that as well. Supporting natural areas where individuals can exercise. So this can be helpful for you and your clinic staff if it's nearby, but it's also really nice for clients and other people to get physical activity. And then thinking about different sort of even small changes to support, as I said, pollinators, bird habitat, small mammal habitat, and there's lots of resources from nature organizations on how you might be able to contribute to this. And as I wrap up for today, as we continue on this conversation about supporting nature and thinking about those ripple effects, some things that you can do within your own practice, if you already do staff events or if you do clinic events, think about incorporating nature into that and sustainability initiatives. So maybe you're going to participate in a tree planting initiative, or you're going to help clean up garbage in a local area. You could also think about things like canoeing, going to a local park, or bird watching, as there's evidence to suggest that when people feel much more connected to nature, they are much more willing to fight for its existence. And so it helps generate that momentum. And especially if your team is really rallying behind this, it can be a really strong motivator and continued motivator for why you're implementing the changes that you are. So for nature, thinking about coming full circle, there's just so many co-benefits. So when we support nature, we're not only supporting the health of other species, which we likely very much care about, many wildlife species, but because our health is so intricately connected to a healthy environment, to biodiversity, and the same of our animals, when we support nature, we support overall health, including the health of our own and the clients that we care for. And so as we wrap up our session today, just to revisit, we talked about building your core, thinking about your empowered team with goals and a clear path to success, choosing and implementing behavioral changes to meet your sustainability goals within your clinic. And then today, championing sustainability locally, regionally, and nationally, and seeing where you can take some of the ideas we shared today, what might be a good fit for you, and where you might be able to start to have your ripples go out into your community. So what's next? So this 4-part series, which again was sponsored by CVMA and the Canadian Animal Health Surveillance System, which have been great partners and are really keen in promoting sustainability within the veterinary profession. And these 4 sessions really focused on pathways to a sustainable veterinary clinic. So within clinic space. as we move forward, the CVMA convention, which is taking place June 29th, 25th to 29th, so sneaking up very closely in beautiful Victoria, British Columbia. The National Issues Forum, which occurs on the Thursday, June 26th, that's the Thursday, is focused on pathways to a sustainable veterinary profession. So we've talked about the clinic, and now we're really thinking about what do we need within our profession and how can our profession take sustainability to the next level. There are three super speakers, actually five speakers that are Canadian and international that are coming to be part of this. It's a mix of presentations, initial presentations, and then at an hour of discussion that everyone can participate in. And so I really encourage you, if you're going to see the CVMA convention, to participate there. The CVMA convention has also been really thoughtful in thinking about how the conference can happen in a more sustainable manner. And there has been several changes that have occurred this year to support that. And then also at the also at the convention, there's on the Friday a full One Health stream, and in the morning there's two sustainability related talks delivered by Dr. Dickon Westworth, who you would have heard from in the clinic space. So there's lots of opportunities to continue your learning and conversations. VSA will also have a booth at the convention, and so we welcome you, if you're there, to stop by, chat with us, share ideas with us, and we'll continue on this sustainability journey together. So I have a few minutes left. If there are any questions, please feel free to enter them in the chat. There's the emails for Dr. Ian Alexander and Dr. Ian Sandler, who are both really active in the National Issues Forum, are up there, and you can send your photos or slides of what you're doing in your clinic to either one of them. And just as we're wrapping up today, in case there's any questions that do come in, all these webinars have been recorded. And so if you missed one in the series of 4, you should have access to the CVMA to go back and listen to it. Or if you missed something, they're a great resource for you to revisit.
Not seeing any questions, Katie. Thank you very much for putting on this presentation today, and thank you for all the attendees.
Great, thanks so much for coming, and thanks to the CVMA and CAS for hosting.
Have a great day, everyone. Hopefully see you in Victoria.